working. So what we're talking about is humbling ourselves. We're talking about the process of being humble. As long as I'm blaming, there's no humility in that. So anyway, we done gone into a lot of stuff. But if I could change one thing in the field I work in, and I think I'm going to talk about this Friday, because I started figuring out what I'm going to talk about Friday. I think they need to take people with lived experience and stop making them the dog and pony show and really listen to them in the decision-making process when it comes to policy and procedure and structure. Because they come to us now and have peers review stuff. They always ready. These are COCs and these community service boards. They love to put a group of peers together to review some stuff. Review it. They've already. That's what we're going to do. Can y'all review it?
Right.
They need to put the peers in the conception stage and stop using peers as a dog and pony show.
I agree wholeheartedly. And that was actually something I wrote down, which I battle in, in behavioral health way is, have you asked these people what you proposing for them? And usually it's a no. So, or we was going to exercise last year in our cohort, and my manager here, he's a clinician, idiot too, he put all these post-it things on the wall, and he had the young people come up and say, okay, what is it that people want? All people want these things. And I'm like, that's not true. All people don't want to be housed. All people don't care about food, clothing, and shelter. Because he's never been on the street. I call him a house cat. You ain't been on the street to ask these people, and that's what I'm saying. Do we ask what people want, or do we just give them what we think they want? Or what we think they need?
Well, what you're saying is probably the most racist, discriminatory, biased point of view somebody working in this field can have. And so they have the bias and the discriminatory look or position of thinking people can't. And so because I truly internally believe that they can't, I'm going to make it real easy for them. I'm going to lower the bar so low that they can get under. They're not thinking big, sky's the limit for these people. They've already decided that these people can't. So I'm going to make it easy for them, slide them around under. And that's the worst kind of ism you can practice. And most people without lived experience, they tend to be that way under the misguided thought that they're being compassionate.
Right.
To me, compassion has less to do in this field than overall knowledge of the process as what's going to happen to people. And you can't do that. You can get that. I don't believe, excuse me, I don't believe you have to experience it to be proficient at it. I believe you can get it another way. Learn it from somebody who has the experience. But if you think knowledge is all powerful and your degree with your ink still wet or your license with the ink still wet allows you to be an expert.
Right.
When you got some people sitting around you who have lived it, recovered from it, and now got credentials themselves. Because I work both sides of the street. I'm a clinician as a CAC or now an ACAC and a CPRS. So I've been on both sides. I've been on clinical teams and I've been on the peers team. Let me tell you, they pay lip service to what peers have to say. Only because they have to. If I'm getting a grant and the grant says I have to have 2 peers, then I'm going to hire 2 peers. But really, I don't think I need them because my ego and my pride is so blown up or overblown because of my education accomplishments. But I watch them go to the DSM-4, whichever one they're using there, 5 or 6, whenever they don't know what's happening with a client. Whereas the client come talk to me one time, they're like, Mr. Williams, what you think? Yep. See, you have to learn that from somebody if you don't have it. I do not believe the best people are people with lived experience as much as I believe that the best people are the people who can take advantage of the lived experience even if it's not theirs.
Agreed. I agree. Yeah, because I was saying, credential don't mean qualified. You just credentialed. And that's cool, but you don't have the experience. And I think that's what leads to make a lot of clinicians, they ruin a lot of people.
You know, I'm gonna go further than ruin, Joey. They kill people.
Oh,
I did a 3-year, before I came to the county that I worked for, I did 3 years at a Northern Virginia treatment center that has the distinction of being the oldest alcohol treatment center in Northern Virginia. And they've been around a long time. And some of the clinicians there come to us directly from a local university that we partner with to provide practicum internships. And we kind of have this loose confederation with this university. The majority of our clinicians that we hire came to us through internships from this university. And when they graduated, we give them a position that their business card would say therapist candidate or so-and-so candidate on the business card. But people don't pay attention to that. They don't know what that means. If I'm working with this person, then he's my counselor, he's my therapist. They don't understand the difference between therapist candidate or whatever candidate. So here's my point. They can kill people. And I've seen it right there in that particular facility. They don't know what they're doing and they won't take time to sit and learn. As soon as they get there, they feel like they're playing some role on a medical TV show like Grey's Anatomy or ER. And they can't wait to get in and do the work. But they don't understand that once they come out of school, then the learning starts all over again.
right.
And you learn from your colleagues who are seasoned. They come right in. They start doing groups. They start wanting to do individuals and family therapies. And last week they were in school. And so what they fail to realize is you have someone's life in your hands. They don't know the difference between you being in school, an intern, or a seasoned veteran.
Right.
They don't know the difference. They just assume you are. Okay? And I've seen people die. I've seen some of my colleagues have to go get mental help because one of their clients died and they were so distraught over their clients dying. And so they come to me and they said, Wendell, she's upset because so-and-so died. And I'm saying, okay, we're in the dying business. Anybody who does the work I did with opioid addicts, you have to understand very quickly, people are going to die. It's part of what we do. I can't say who, and I can't control who does it. But if they keep using long enough, especially since 2016 when fentanyl hit the scene, people dying is all part of the work. And that's one of the things. I don't have the power to save anybody, nor do I have the power to kill them.
Fentanyl. What's your thoughts on fentanyl? And I want to jump to something because you in DC, right? I was looking at the news the other day, Trink, that they calling it now. Have you?
Trink?
Trink. It's some animal tranquilizer that people are using.
Oh,
now.
you're talking ketamine or
Ketamine.
Trink.
They call it Trink. I guess it's some new drug. It's now in Baltimore and in New York.
Is it a synthetic?
I think so. It's being cut.
We have a big problem with the dark web. I had a couple of my clients while I was at that North Virginia facility who were getting stuff like what's it called? Oh my God. It's something new that mirrors the effects of heroin, but it won't show up in your test. See, young people are getting real ingenious. And the first thing I say to them, why come to treatment if you still want to get high? And that's because most of them are coming for mom or dad or for the legal system, criminal justice system. So they go on the dark web and they buy stuff that won't show up in the current tests we have. So right now, I think the 12 panel is probably the gold standard right now, but some things don't show up in the 12 panel now. So we've got to be able to catch up because I don't want to say the Chinese. Did I say Chinese? There's some synthetic drug makers that stay a step ahead of that by changing one or two molecules in a concoction, and it doesn't show up, or neither is it prosecutable by the United States government as an illegal drug. Because you got to remember, the synthetic stuff people were smoking was actually marketed as a bath salt or an incense.
I remember bath salts. Bath salts.
And so that's what's going on now. I'm trying to remember, I think it's Kronk, something is the one that mimics heroin, but there's a lot of stuff you can buy on the dark web. I don't even know how to get to the dark web, but young people do. And so what happened was people discovered, because of what was happening in China, and that's where most of the initial fentanyl came from, now Mexico, and they discovered that they could put fentanyl in really weak heroin packages. They could overcut the heroin, put fentanyl in it. But another reason we had a lot of overdoses while I was in that particular program is because heroin is stronger now. During my heyday, you'd be surprised to find heroin at 4%, 5%. Now, not unusual, way heroin is closer to 50, 60% pure.
Wow.
Okay? And so a lot of people don't know the purity and they're using the drugs and they overdose. Conversely, when you have something that's not really good or stepped on a lot, they will introduce fentanyl to punch it up. Now you're finding fentanyl on crack cocaine. In about 2019, we had our first report of deaths from fentanyl being laced on crack cocaine.
Wow.
And it happened in Cincinnati, Ohio. 4 people sitting in a car smoking crack. 2 of them went out, 2 of them died, 2 of them survived. And that was our first report of fentanyl being used in cocaine. Right now, fentanyl is being used in a lot of different things, including marijuana.
Yeah.
Including marijuana, because of its properties to boost the high or give you a stronger high. And so in my day, they used to call it tie sticks. And that was marijuana on a stick, and they would spray it with heroin. So it'd be like smoking heroin and the marijuana.
Yeah.
So now, that's what you have now by lacing stuff with fentanyl, that same effect. So the only true way to protect yourself from a fentanyl overdose is not to use any drugs, especially any of them that you're using intravenously. And while I'm on the West Coast, I'm going to really just give a shout out to the idiots in Portland and the idiots in Seattle and the idiots in San Francisco who believe that public injection sites
Oh my God.
is the answer to all this. You know, in San Francisco, I heard, I make sure I don't want to defame San Francisco.
Oh no, I can tell you all about it. Go ahead.
But one of those 3 cities, they're even giving them new, clean crack pipes.
I used to make them doing outreach. We call them safe smoking and safe shooting kits. We gave everything but the needle.
Yes.
But I can tell you to go to needle exchange, got the clinic, they'll give you a new needle and take the
So
needles.
this is insanity.
It is.
This is insanity. And a lot of the homeless issues, Portland, Seattle, Manchester, New Hampshire, West Virginia, it's around open injection sites and the diversion programs for being caught with hard drugs. Some of these cities now, it's mandated they catch you and they think you're a user, they don't have to lock you up and charge you.
Correct.
Okay? So now you've got amnesty for drug use. Now you got communities now that have been taken over by everybody involved in this craziness. But yet some of my colleagues think it's better to have that than people die. And they don't realize
Still dying.
people die in this business. In this business, people will die. We cannot save everybody from their destiny if they want to continue to practice unsafe behavior. It doesn't got to come from a drug overdose. It comes from AIDS. It can come from being in the wrong car, being in the wrong place at the wrong time.
violence,
all kind of stuff. But if you weren't in that game, you wouldn't be subjected to that happening as an accident as high as you would just walking down the street.
Exactly.
So people are dying in this business, man. There's no way you can get around it. So to me, harm reduction is a failed approach. And it's all because they think the old approaches are passe.
I agree. And even with those injection sites, so
Madness.
what tripped me out, they put one up in downtown San Francisco. They put it up right there. We call it the shooting gallery, but it's UN Plaza. And then they just took it down one day, but it's like, okay, now where the people gonna go? I've never been in there, but one of my previous interns worked in there. And I was like, they're really up in there just letting them shoot up and all that? It's like, yeah. But at the same time, they want to provide peer counseling. Who want counseling when they getting high?
You know what? I used to have to go to the emergency room for overdoses. Police would call me. And, they get the Narcan, and they come out of the overdose, and they're pissed because you ruined their high. And then when you say, look, let me get you in detox and get me in treatment, they'll say, I'm good. They go right out the door to get high to do it again. Mm-hmm. You see, it's like the system can't save people from themselves. We're only so effective saving people from themselves. The best way to save a person from themselves, and a lot of people hate me when I say this, is lock them up. There are just as many people who have gotten clean and sober as a result of getting locked up as people who went to rehabs and to get clean and sober. Because it gives you time, first of all, to stabilize. It gives you time to be in a safer environment. I'm not going to act like jail is safe, but it's safer than being on the street.
Right.
Your mother doesn't have to worry about where you at. Your grandmother ain't got to worry about what happened to you. Like when you're running around the street, your family's just worried to death on that phone ringing, right? So now you got that. Then you're going to sleep, and you're going to eat, and you're going to rest, and you're going to stabilize. And if you're going to be there a minute, you might have this moment of clarity that all alcoholics and addicts have. Where in this moment of clarity you go, wait a minute, I must be losing my rabbit ass mind. Because at the end, the thought for me and a lot of people that I've heard share about it was, if I don't get another hit, I'm going to die. And at the same time, I'm thinking, if I get another hit, I'm going to die. Damned if I do and damned if I don't. And that's what most recovery literature calls the jump-off point for recovery. When you're stuck. You can't do it right. You can't do it wrong. You can't even kill yourself right. I've had stories of this one guy who jumped off this bridge in D.C. and didn't die.
Wow. Into water?
Yes, jumped off the Key Bridge. He was frustrated because he couldn't stay clean. Couldn't get clean, stay clean. He jumped off the bridge and didn't die, and that was his moment. How frustrating can it be when you can't kill yourself right? Okay?
Obviously, you're going to say, I'm going to get right.
This is his moment. I just think what we're doing is we're taking away that moment from people. We're taking away that moment where they got to shit or get off the pot. And our job is to help them once they decide to get off the pot. That's our job. Our job is to help them save their lives, not save their lives. I'm not an EMT.
Right.
I'm not coming in a fire truck. Right? I'm here to help you save your life. Actually, I'm here to give you what you want. See, I do not require that people recover like I do, or like I did, and like other people do. I ask people, how you want to get out of this? What's your plan? My job is to help you with your plan. If you ask me what should they do, I'm not going to tell them what to do. I'll say, when this happened to me, this is what I did, and this is what I got, so maybe you might not want to do this. Or, this is what I did, and it worked.
Yeah.
You feel me? My job ain't to tell you what to do. My job is simply to tell you what my experience has been.
Agreed.
And I cannot save nobody. I am not God. And I think too many of my colleagues think they can save people. We can't.
That's like coming there with the, and it's like, no.
Y'all upset. because somebody had an ending or a bad situation before them. It's just our job again to show them where the water is in case they get thirsty.